Hey guys, it's Dr. Kresimir. I'm a chiropractor here in London, Ontario, Canada, and on today's video we're going to be talking about 3 exercises to do for low back pain and sciatica. Before we get into the exercises, I promise I'll get there as soon as I possibly can. There are some important things that we need to discuss so you understand the mechanism and the purpose of the exercises, and also what it should feel like and things to help you gauge whether you're doing it right or not. As always, if something doesn't feel right or if you're not sure, please contact your healthcare provider. Try that again, your healthcare provider. Sciatica and low back pain are not fun and are no joke, and make sure that they're being handled properly. Now, one of the issues when it comes to pinpointing exactly where your sciatica or where your low back pain is coming from, it's a challenge because there are a lot of potential causes to this problem. So you're looking at a low back and a pelvis on my model spine. These 2 dimples down here and these joints in here are called the sacroiliac joints. And these 2 dimples, when you get out of the shower and you can see those 2 dimples at the bottom of your spine, these are those 2 dimples. So in between there we have, this is L5, this is L4, this is L3, this is L2, this is L1, and then the T-spine or the thoracic spine starts up here. At the front, you'll see that we have these discs, we have these joints back here called facet joints, and in between here are the nerve roots. Now, when you're talking specifically about sciatica, sciatica is pressure on the sciatic nerve. Now, potential problem number 1 is that there's some pressure, whether it be from a herniated disc or a narrowed canal or a compressed vertebrae. Sometimes that can put pressure on these nerve roots. Now, the issue is that these nerves come out and they join and form the sciatic spine or the sciatic nerve, which comes through here and then all the way down into your leg to the bottom of your foot. So the cool thing about anatomy is, yes, it's true we all have the same parts, but sometimes those parts vary. So for some people, the sciatic nerve is composed of nerves from L5, L4, L3. For some people, it's L1, L2, L3, L4, L5, and it varies depending on what your anatomy looks like. So the potential problems could be, like I said, a herniated disc. They could be these facet joints in here that are jammed up or not moving properly. There could be pressure on the nerves coming out of your spine. There could be pressure on the muscles in your glutes. There could be pressure from the muscles in your hamstring. There could be problems with the knee. All these issues are potential causes to definitely sciatica, and some of the ones that I mentioned are potential causes to low back pain. So what I'm saying is, don't give up hope, and if these exercises help you, perfect, then we know that we're onto something. But if they don't give up hope and continue to, seek the help that you need. So exercise number 1 that I'm going to be showing you is a distraction exercise. So a lot of us are walking around and there's a lot of compression and pressure on our discs, and what that does is it can cause some pressure on the spine and the nerves coming out of the spine. So what you're gonna need for this first exercise is a chair, like the one behind me, and what you're gonna wanna do is find a comfortable position in the chair like this. What you're going to do is keep your feet on the ground and get your body weight out of the chair. You can support your body weight. And then what you're gonna be doing is tilting your pelvis up like this and taking some of the pressure off of your lower back to helping provide some relief. Now, a couple things. If you're dealing with sciatica, which is pain referring down into your leg, which can be accompanied by back pain, if you perform an exercise and the pain in your leg lessens, meaning it goes from your calf up to your thigh or from your thigh to not at all, that's an improvement. That's a concept called centralization. If you're able to take the tension off the nerve and the pain recedes back up, that's an improvement. So that's something that is a positive sign if you're doing it. Now, the exercise that I just showed you, distraction, it's important that when you get in a position that you're helping your spine gently pull apart and restore some of the motion in there, you don't stay in that position for too long. I would count to 5 if you can get in that position, and then sit back down and gently apply some normal sitting force on your spine. The reason is if the ligaments and the tendons stretch for too long, they can stay in that position, and that could be really painful. So distraction is a very powerful exercise. Don't stay distracted or lengthened for too long of a period of time, and I would repeat it for 3 sets and then reassess from there. The next exercise that I'm going to show you is for piriformis syndrome. I'm going to be moving my phone down. You're going to need a foam roller. Now, as I was explaining, there's the piriformis muscle that comes across like this that can sometimes trap the sciatic nerve. So you're going to take your trusty foam roller. You're going to sit on your foam roller. I'm going to be working on my right glute here. So I have my weight on the foam roller. Step number 1 is to just lean to get the foam roller into the belly of the muscle and just roll it up like this. There can be a lot of trigger points in your glutes, so you might want to be gentle as you're doing this. If this is too loose, another thing you can do to apply even more tension is to get your foot over like that. So put your right ankle on your knee, and what that does is that'll increase, because now I'm flexing the piriformis muscle, or I'm extending or stretching the piriformis muscle, and that'll help break down the scar tissue in there. There's no limit to how often you can do that, especially if you have scar tissue there. It can be painful, so go slow. That one can produce some bruising, so again, please go slow. I would do it for 30 seconds, get up, move around, and then do it for another 30 seconds. The last exercise that I'm going to be showing you is a glute activation exercise. So again, we want to be on the ground, nice and flat like this, excuse me. And then what I'm going to be doing is keeping my knees straight. I don't want my knees to flare out like this. My head's going to be back, my upper back is going to be relaxed. I'm going to be firing my glutes and squeezing at the top. And the idea behind this is to make sure that I'm taking some of the tension off of these joints here, making sure that by strengthening my glutes, I'm going to be strengthening helping my lower back fire properly, and hopefully take some of that tension off of L5 and S1. Give this a shot. Let me know how it goes. For the glute activation, I would do 3 sets of 8. Try to squeeze and hold it at the top for 2 or 3 seconds, making sure we're really turning on and firing those glutes. Like I said, that'll help stabilize your pelvis. Give it a shot. Let me know how it goes. If you have a comment or question, post it below. I would love to hear from you and help you if I can. Have a great week, and I'll talk to you soon.